Hi, my name's Tiffany. Today, me and my sister are going to talk about a disease that has been hurting a lot of children in low to middle income countries.
It's the diarrheal disease. According to the WHO World Health Statistic Report, just in 2016, there's over 470,000 children under the age of 5 died from diarrhea. It's a treatable disease over here in Australia, but has an extremely high mortality rate in poor countries like Southeast Asia, some parts of Africa, and South America. There's different causes to diarrheal disease, the main being virus, bacteria, and malnutrition. In this video, we'll focus on cholera. Cholera is an acute infection of the GI tract caused by the bacterium Vibrio cholerae. It's a gram-negative bacteria with flagella and pili. Flagella helps it to move once it's at the small intestine. Pili helps it to stick to the villi. Despite it can cause severe diarrhea, it's non-invasive, so it stays at the surface of the lumen, but the toxin it produces can go in. When Vibrio enters the body, it doesn't really have an effect at the stomach because of the acidity. It's too high for Vibrio to invade through. The patient that will have a higher risk is that if they have a low pH at the stomach or if they take drugs like antacid. When Vibrio moves over to the small intestine, that's when it can cause an effect. Vibrio can't actually invade through the layers, but the toxin it produces can. When the Vibrio attaches to the surface, it can produce this toxin. A subunit of the toxin can actually go into the cell and cause a chain of reaction. The end result of this is that chloride is being released into the lumen of the GI tract, and then there's a decreased absorption of sodium bicarbonate ions. Water would follow the osmotic gradient, and there will be an excess amount of water being accumulated in the lumen, which causes the secretory diarrhea. Other symptoms of cholera includes vomiting, dehydration, and nausea. When it becomes severe, it will decrease your blood pressure, cause muscle cramps, and when you have hypovolemic shock, that's when it becomes fatal. Different pathogens can cause diarrheal disease, and it's hard to know which specific pathogen have caused it without the proper lab equipment. In labs, we can analyze stool sample through PCR and ELISA, but in most countries that are heavily affected by these diseases, they won't necessarily have the resource or facilities to do so. So the simple and most effective treatment would be fluid and electrolyte replacement. To prevent diarrheal disease, it's quite important to have clean water facilities, but in some regions, these are still quite hard to achieve. So for now, the best thing we can do is to educate, increase awareness, advocacy, to bring resource into these regions. That's it for today. Thank you for listening.